What's up? I'm Hutch, and you need to better understand breath sounds so that you can better take care of your patients and also pass the NPTE. Just like you use a stethoscope to listen to heart sounds, you're going to do the same exact thing to listen to lung sounds. So you'll start superior, you'll move from left to right across the body back and forth, comparing each side of the lung sounds and listening to a full inhale and exhale at each point. The intensity, pitch, and quality should be the same on both sides for each position. In the upper portion of the airways, breath sounds should be loud and tubular. This is called either tracheal or bronchial sounds due to the anatomy there. The lower airways should sound high-pitched and breezy, and these are called vesicular sounds. In the gray area in the middle, you may hear a mixture of these two types of sounds, and these are called bronchovesicular sounds. If you're not hearing any sounds at all, it could be due to something like a pneumothorax or a lung collapse. If you're hearing diminished sounds or they're quieter than you would normally expect, this could be due to congestion, hypoventilation, or emphysema or other types of COPD. If you hear the sounds loud and clear, but they're a little different than you would expect, this is called abnormal or adventitious sounds. So for example, if you heard bronchial sounds in the lower airways, that would be considered abnormal. And that may indicate some type of pneumonia or other condition. If you hear little popping sounds or like two hairs being rubbed together, this is called crackles or rales. And this is due to secretions opening and closing as air moves through these small airways. If you hear more of a dry crackling or rubbing, this could be due to inflamed pleural, which causes a pleural friction rub, and this will only occur in the areas where they're having some discomfort. A low-pitched gurgle is known as rhonchi and could be due to spasm or some type of obstruction in the airway. A harsh vibration in the upper airways is called stridor, and this is usually due to an obstruction as well. And if you're hearing more of a musical whistling, this is called wheezing, and is usually due to a narrowed airway from edema, secretions, collapse, etc. While you're auscultating, especially if you hear anything funky, you may want to perform some additional tests as well. Egophony is where you have the person say E, but it sounds like an A through the stethoscope. Bronchophony is where your patient will say 9-9, and it will sound louder and clearer than you would expect through the stethoscope. Pectoriloquy is when your patient will whisper 1, 2, 3, and you will hear it louder and clearer than you would expect through that stethoscope. Each of these sounds is warped through consolidation, atelectasis, fibrosis, or another condition like this. Now it's time for NPT Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. This can be due to air passing through a narrowed airway. Hopefully that covers all of our bases. If not, you can always check out the description box below for a link to my notes on Etsy. Otherwise, comment with questions or suggestions for videos I should do in the future. Good luck studying. Go change the world.